Good afternoon. I am Brooklyn Borough President, and I'm really happy to be joined with my colleagues, Council Member and Council Black, Latino, and Asian Caucus Co-Chair, Councilman Daneek Miller, Council Member Edonis Rodriguez, Council Member Adrian Adams, Council Member Matthew Eugene, and also Council Member Farrah Lewis will be joining us as well as we deal with this very real issue around the vaccination process in COVID-19. We have a dual role. Number one, to be credible messengers as elected, to talk to our constituency where you have a level of reluctancy to move forward in this conversation, but also to ensure that government does its job of expediting this process. New York's are seeing really a lot of conversation, dueling conversation, instead of us moving towards the one destination, and that is vaccinating as many people as possible to ensure it's done in a diverse manner and to ensure that we reach herd immunity. And it's imperative that right now, as we look at the process, we know that the only thing that can heal and really kickstart our economy is to get COVID-19 under control, and we do that with the vaccination. And we need a real-time assessment model that will ensure that most highly impacted zip codes are sufficiently supplied, and that if we do it in a manner with the level of the diversity of ensuring that we don't make the same mistakes that we made in testing. We did not monitor in real time the testing, and we learned later that communities of color and economically challenging communities were not receiving the proper amount of testing. If we don't inspect what we expect, it's all suspect. And we say that over and over again. Last week, this team sent out a bipartisan 5-borough letter to the city and state health departments urging them to adopt our plan. Our plan is simple, and it's a simple way of expediting the vaccination process. As we stated in the letter, we are in a race against time to achieve herd immunity and beat back this virus. So dual role that we must play. As of Friday, only 160,949 people out of 325,000 doses have been administered in the city. Only 34%, unacceptable, which was lower than the state average. We have to do a better job. Governor Cuomo announced, after the calling for many of us to open up and merge 1A and 1B so that we can move this forward, and we need to be clear. There was never a time that there was a mandate that we only could do 1A. It was a recommendation. And so we're happy to see the state now move to a 1A and 1B to include both groups. At the same time, we're expanding eligibility to who can get the vaccine. We need to take a closer look at the racial breakdown of those receiving the vaccine. We are clear that there are some people who are reluctant. So if we only allow 1A and 1B to be one ethnic demographic, we're back where we started from, and we can't allow that to happen. We have seen throughout the pandemic that the virus took and continues to take the greatest toll in communities of color, like the ones that we represent. We know far too clear: South Jamaica, Queens, St. Albans, Laurelton, Flatbush, Upper West Side area, Washington Heights. These are our communities, and we know the impact of this. City data shows Hispanics and Black people have died from COVID twice the rate of whites. Black and brown people are more likely to be hospitalized from the disease. Also, we know, which is often overlooked, that there has been a serious underreported impact on our Asian communities. South Asians have had one of the highest rates of test positivity, while our Chinese neighbors have faced one of the highest mortality rates. So this is clearly impacting certain communities. As I said before and will continue to say, COVID-19 did not create these inequities, but our city and state's failure to track and respond to these cases in real time have helped to deepen these inequities and contribute to the disproportionate impact on communities of colors and South Asian and Asian groups. We cannot repeat the mistakes at the beginning of COVID-19. That's why today we're calling for the city and state to create a real-time, transparent reporting system that tracks vaccinations broke down by racial groups and those who are there by various zip codes. And so to collect data, we're calling on the city to require racial data to be collected at the time of administering this vaccine. This is a form that's filled out. Right now, race and ethnicity is not included on the form. It's not required. Everything else is required but that. If you're not collecting the data of race and ethnicity, how are you going to know the equitability and the distribution of the vaccine? We can't do scatter and pray. We must have a real-time analysis. These two boxes must be filled out. Why are we using a form? Why aren't we using a handheld? Why aren't we inputting the data right from a handheld directly into a central database that would allow the public to know in real time? We have to stop using an Oxcot method in an iPhone age to move forward in an agenda and initiative. This is what's slowing down the process, and this is helping to fail at beating the race against defeating COVID-19. So in addition, today, as I turn it over to Councilmember Miller to talk about his resolution, we want to reemphasize our plan. Our plan calls for a 3 color-coded system where the Department of Health should create. It should be transparent. Red for people with the highest level of need, like frontline workers and first responders. Yellow, all of the red group plus the zip codes most impacted by the virus, those with medical conditions that make them susceptible, and those in high-risk industries. And finally, green should include all of the red and yellow group, as well as the general public. Herd immunity is the goal, but herd immunity in some communities is a failure. If we do this in real time, we can reach herd immunity in all communities and achieve the goals that we want, all New Yorkers. COVID doesn't discriminate, but our policies have, and we need to stop it from having it. Councilman Daneek Miller.
Good afternoon, and thank you so much, Borough President Adams, for your leadership on this issue and convening folks together. I want to thank my colleagues at the Black, Latino, and Asian Caucus that have joined me here this afternoon, along with the Bodegas Association and others that are here. We are here because this issue is so vitally important to our respective communities and constituencies that we serve. It is clearly evident now that the communities that were most impacted by COVID-19 are those traditionally, historically marginalized communities that have been disproportionately impacted. And we were impacted because we did not have proper infrastructure to support our healthcare needs. We didn't have proper policy to support our healthcare needs. And so we are here to address that in advance. We are here, as Borough President so aptly said, as critical messengers of the coronavirus, because our communities have lived that. And so we at the Black, Latino, and Asian Caucus have gladly joined on to the letter of the Borough President. And that letter, as he put, makes demands that we have coordination between state and city, something that we have not had in the past. While we commend the governor for the work that he has done and what he has put out, certainly his announcement and his policy can go a step further in ensuring that these communities that have been most disproportionately impacted, that they are receiving this vaccine. And so we've done a lot of work, us individually, to ensure, as those credible messengers, to ensure that our communities recognize and understand the value of the vaccine, the value of us. Look, we are still traumatized as a community. We are still suffering from what we've seen in March and April and May in our communities, the constant barrage of ambulances and death that was all around us. And so we have gotten beyond the skepticism and recognize what our options are. The options are do nothing or do vaccine. If we do nothing, the outcome is certain, and we've seen that. And so we want to make sure that the distribution is safe, it is efficient, and it is effective. And most of all, that it is equitable. And we want to make sure that those communities that were most impacted are receiving access to the vaccine. What we have seen in the past is not having access to testing. I think it was the same group of council members, along with the borough president, that called for testing beyond what we were seeing, much to the chagrin of others, and we recognize that testing was important. Now we're saying that the vaccine is important and that we want to make sure that we are receiving that. I want to have an opportunity for my colleagues to speak, but I want to talk specifically about those essential workers. I want to talk about it's not an accident, nor is it mutually exclusive, that the people that make each and every one of our lives so seamless and allow us to do the things that we do, even in the midst of the difficulty of COVID, those municipal workers, those public employees, those essential workers in retail and deliveries and all the things that we have taken for granted, that they are recognized. Because we have this conversation and then we start talking about heroes and sheroes in one context and in that moment, but when we start talking about the rollout, we start talking about a different kind of worker. We're talking about a working class professional that opted out of coming to work and stayed home, right? And we're talking about them, or we're talking about a group of folks that sent out a memo that said that they did not have to, because of their work circumstances, would not be answering COVID calls. And meanwhile, the black and brown folks of EMS and others were answering those calls. And so we want to make sure that the governor is hearing us, that the mayor is hearing us, because it is not an accident that these same groups and demographics of essential workers risked their lives, got infected, came back, infected family and community. Thus, this is why these same communities had the highest rates of COVID. And so we want to make sure that we're doing whatever we can do to mitigate that from happening in the future by addressing how vaccine is being distributed. And so I, along with my colleagues in the caucus here, will be introducing a resolution that addresses this continuity between city and state, but most importantly, addresses equity, distribution, and the real-time aggregation of the data that supports and will give these communities access. in a very culturally sensitive way. So I want to thank the Borough President. I want to thank my colleagues. This is so absolutely important that we are here, that the world knows that we are ready, that we are that credible messengers, that we will get it out, and we will make sure we are here because we want to ensure that these communities that are at risk and most disproportionately impacted have access. So thank you so much for coming out. Councilmember Adrian Adams, my co-chair of the Black, Latino, and Asian Caucus.
Thank you so much, Co-Chair Miller, and thank you, Borough President Adams, for your leadership on this issue. Good afternoon, everyone. I'm Adrian Adams, co-chair of the Black, Latino, and Asian Caucus of the New York City Council, and I represent Richmond Hill, Queens. That is a part of my district in Queens, District 28. Richmond Hill right now has over 16% positive rate of COVID. So we are looking at a rollout of a vaccine that pretty much excludes that population right now because of the prioritization of vaccine. We are basically going through the same exact pattern of vaccination that we did in ignoring testing for communities of color when the COVID-19 was first discovered, and we noticed that the dominance of COVID-19 ravaged communities of color, not just in the city of New York, but across this country. So why would we want to continue a pattern of what seems to be racial disparity when it comes to the healing of this pandemic? So we're standing here today in solidarity to ask the mayor and governor, no demand from the mayor and governor, that coordination, careful, close, considerate coordination be a priority for them, and that they take a look at the past mistakes and not repeat them again. We cannot afford for this pattern of racial disparity to be formed once again, to be repeated in such a way. Families are afraid. Children have lost parents. Parents have lost grandparents. We have lost family members. We are tired of the loss. Yet there is a vaccine available now that is not accessed by the very communities that have seen the most tremendous loss in this city, the most tremendous loss that the city has ever seen. We are looking across the country right now where bodies have to be stored in unfathomable spaces. This is something that we are doomed to repeat here in New York if we do not take a page out of our own history book and fix this. We have an opportunity to get this right. So heavens knows why the mayor and governor will not together work to get this right. New York is the model city for the world, in spite of our problems, in spite of our issues, in spite of ourselves sometimes. We are the model, and we set the scape, the plan that the world takes a look at to see how things are done. Goodness knows we had a president that didn't get it right, where the world had to look at Governor Andrew Cuomo to get it right, and to figure this thing out and how to get the curves flattened across the United States. So why are we looking at a pattern that is destined to doom us once again? We stand here today to demand that the governor and mayor get their act together, do the vaccine access appropriately and equitably for all of the citizens of New York. Those, as my colleague said, those that are standing in essential lines, those that are standing to give us our groceries, to drive our taxis, all of these things that are essential to making New York the vibrant city that it is, to make us continue to have our subways full in spite of a pandemic. We are 100% compliant in the MTA on our trains right now because New York knows how to do this, because this is what we do. So let's get on board, Governor. Let's get on board, Mayor. We know how to do this. Let's get the vaccine accessibility right. Let's do this right for all New Yorkers.
I feel that we have a big responsibility to address the question of equity, as my colleagues say, and I feel to get what we should be. The leadership of the Brooklyn Borough President is so important because he didn't go to the Hudson Valley, he didn't go to the Hampton in the last couple of months. He stayed here, fighting the battleground, in the battleground when it comes to be sure that Black, Latino, Asian, poor, white, because this is about social class. It's about to be sure that all New Yorkers, regardless of the socioeconomic, are connected. In this particular case, it's about the vaccine. But in the last couple of months was about testing. And he was there. And for me, as a council member that represent also Northern Manhattan, but as a former co-chair and working with the great leaders here of the Black and Latino and Asian Caucus, I can assure all New Yorkers that with this leadership, we will be sure that the mayor, the governor, understand that it's not enough to say in New York City, people should not die because the ethnic background. Well, they died. They did. Now the question is, will all New Yorkers, in this case the poorest one, will have access to the vaccine? We need to address the question of who, when, and where will get the vaccine. There's a lot of confusion. Yes, last night I spoke to the home attendants that take care of my mom. My mom have advanced dementia, and she's one of 100,000 New Yorkers, senior citizens, that rely on the home attendants. And Candida asked me last night, Daneek, do you know when I can get the vaccine? Well, I've been told, since we had a press conference together in Inwood, that the home attendants are already on the line to get the vaccine as we are speaking right now. But the agencies have not sent a letter to the home attendants. The city has not contacted the home attendants. And they are taking care of our senior citizen population, people that have a lot of pre-health conditions. So having a clear plan that people know when, who, and where they will get the vaccine has to be addressed as now. Any hour that those individuals who need the vaccine and should get the vaccine are not connected with those information, we will put New Yorkers in risk. So muchas gracias al presidente del condado de Brooklyn, a su liderazgo. Él no se fue para los Hamptons, ni se fue para Hudson Valley, ni se fue fuera de aquí en estos meses. Él ha estado luchando para asegurarnos que la gente pobre, los negros, los latinos, los asiáticos, también tengan la asequibilidad al tratamiento del COVID-19. Y en este momento la pregunta es, ¿quiénes, dónde y cuándo van a recibir la vacuna? Los más pobres, los que les fueron afectados, incluyendo de ellos nuestra gente, deben de recibir la vacuna en este momento. Thank you.
Thank you. Thank you very much. I'm Matthew Eugene, and I'm the City Council member representing District 40, and I'm also a member of the Black and Latino Caucus. I'm so delighted to join the Borough President Eric Adams and also Council Member Miller, our leader in the caucus, and all my colleagues over here to express the urgency to have an efficient plan to make sure that we distribute the vaccine to all communities, because our moral obligations is to protect New York against that vaccine, against that virus. But the problem is, we are New York, all of us. In order for us to make New York safe, we got to make sure that everyone in New York can get access to the vaccine. Everyone, especially those who have been in the forefront. We all know that people from the Black and brown community, from the minority, they were most affected. We know that. And New York won't be safe if we leave aside, out a community. We will be safe in New York when all the communities can get the same access to the vaccine. And we need a plan, efficient plan, a right plan, a just plan that can give access to everybody to the vaccination. And let me say that to conclude, because so much has been said before. This virus is serious. It's very dangerous. and goes very fast, we have to do that also very fast. We got to do it right now. We got to put in place the system that will allow everyone, regardless of the community, regardless of the color of the skin, the socio-economical situation, can get access to the vaccine. We know that the virus has mutated already 2-3 times, and it is not over yet. Even if we got the vaccine, we will see more mutation, but we will do a better job if we can give the vaccine to everybody very quick, very quick. And again, let me say that it is the moment more than ever that the government, the city, the state government, and the community organizations, all the community organizations, the leaders can get together to make sure we put in place those measures that will allow us to vaccinate everybody from all communities. Thank you very much.
Thank you. Thank you. Hold on. Bodega Association.
Yes. My name is Francisco Marte from Bodegas and Small Business Association. We are asking to the government and the mayors that to take to consider us and the front line. We be working, risking our life to give a service to our community, especially the low-income community, where all the bodegas are mostly, and we be facing so much risk. We be facing the risk to bring the virus to our families. We be in contact with hundreds of people. Each bodega come over 300 to 500 people, different people daily. So we don't have all of the equipment as the other agency has. We having some type of relation with our community that is more close, more warm. So it's more easy to have the virus. So we asking, we need to be considering the first, to be one of the first to be vaccinated. We risk our life. We be giving the service to our community. When the city turn the lights off, we stay open. We stay with the light on, giving service to our people, to our elderly, to our children, making delivery. So we as bodegas and a small business, restaurant, barbershop, beauty parlor, taxi driver, we need to be considering to be vaccinated on the first line. We be risking our life to help our community. We are part of the community. Whatever affects our community affect us. Whatever affects us affect the community too. Thank you very much.
Thank you, thank you, thank you. And I just think that what Councilwoman Adams and Councilman Miller stated is so important. The plan must address the need to have an area where your numbers are that high and you are not part of the first wave, then we are not addressing the wave. So this can't be cosmetic. It must be successful in its implementation. And that's why by having a real-time model, ethnicity, zip codes, we could do an immediate analysis of are we tracking the need? And right now we're not doing that. Well, open to any questions? Great, that means we did a good job.
And it's the South Asian community, and it's, because they've got nothing coming from the
Right.